If your smile is ugly and you want your smile to be less ugly, I'm going to tell you everything you need to know to be less ugly. Coming right up. Hey guys, Dr. Robert Stanton here, cosmetic dentist for Lauderdale, Florida. I'm also adjunct faculty, Nova Dental School. I'm also part-time exotic dancer. That's not relevant to this video. The topic I chose to go over today is dental veneers. There's a lot of confusion about dental veneers, even more than the confusion about my sexuality. But what I want to do is give you the information that you need to know to make a proper decision and some other details that are really relevant that a lot of people seem to have questions about. First of all, what are dental veneers? Dental veneers, the word veneer is not exclusive to dentistry. Anytime you take a thin surface and you adhere it to another surface, you have now veneered that surface. Dental veneer is very similar to that. So you're basically taking a thin layer of ceramic and you're adhering it to the front of a tooth.
So you're saying veneers change the shape of your tooth?
Yeah, they actually change the shape, the size, the texture, the symmetry, the proportion. It's, you know, when you get a facelift with a plastic surgeon, they're taking your face and they're making it better. With a veneer, it's like getting a whole brand new face because everything visible is gonna be brand new. So your tooth is still there. Nobody's pulling your tooth. Nobody's doing any major trauma to your tooth. That's very important. The amount of change to the tooth is actually very, very minimal. But everything visible about the tooth is different because every visible surface is now going to be covered with porcelain. Who is the candidate for veneers? Somebody who has a smile that does not look the way that they want it to look. And this could be due to teeth that are genetically too small. It could be teeth that have suffered a lot of destruction and damage. I think the most famous person, I remember this, is Tiger Woods. If you go and you look at old pictures of him, because his teeth are obviously very large, and every time he smiles, they look, you know, they feel like they're in your lap. One of his front teeth was a radically different color than the rest, and that's because it was dead. So I guarantee you he got a single veneer on that tooth to make it match his other front teeth. Basically, we have teeth that don't look the way that the patient wants them to look because of kind of significant structural issues. It could be the front four teeth. Again, it could be trauma. It could be grinding. That's extremely common. People, when they grind, they really destroy the original shape and size of their front four teeth, but sometimes they don't radically affect everything else. It's just the front four.
So say I get veneers, would it be harder to clean my teeth then?
Not at all. Yeah, not at all. So when a veneer is done right, which is a big if, but when a veneer is done right and it's bonded to the tooth, it's literally like two perfect Legos clicking together or two perfect jigsaw puzzle pieces clicking together. So there is nothing different that needs to be done. You brush them, you floss them, you can bite into apples and corn and French bread and pretzels and beer bottles. Maybe not the last one. When they're done correctly, they are almost as strong as natural teeth. So if you Google veneers, you will read a million horror stories about them popping off and chipping and breaking. And I was at my daughter's wedding and I look like a hillbilly because one of my front veneers popped off. But that is almost always due to a technique error when those veneers were done. And there's a million technique errors because veneers are extremely technique sensitive. So it's very important that you go to somebody who has a wealth of experience and knowledge.
Like you.
I mean, I didn't say it. You said it, you know. I mean, Brandon has very good taste.
Do they always make the veneers as white as possible? Or like, can you choose if it's like slightly a darker color so it matches the rest of your mouth?
So like if you do the front four, obviously when somebody smiles, they're showing 10. So those front four need to be the exact same color, shape, texture, characteristics as the teeth adjacent. If you're doing 10, you can have a very subtle color difference between top and bottom, and no one will know. And this has to do with light and shadows and reflection, but subtle color difference. So the uppers can be slightly lighter and no one will know. When you are prescribing those veneers, yeah, they need to color match whatever is going to be close by, or else they're going to look unnatural.
If it's done correctly.
Correct, yeah. I would say 97% of my veneer patients let me prescribe all of the aesthetic characteristics because they want a natural result. But there are some people that just, they want that Hollywood white, and I tell them these are going to look fake, and they say, yeah, that's fantastic. And I say, okay, let's do it, but just don't ask me what I think of them when I'm done. And they leave happy because that's what they want. So that's my job, is to make them happy.
Is there any negative benefits to getting veneers?
Yeah, it really depends on how they look when they come in. So it all depends on what is causing them to not like their smile. If someone's teeth are very crooked, they may think that veneers are the answer. But a lot of times, if those patients have really nice teeth, they're just very out of place, you straighten them and all of a sudden they have a perfect smile. Only time you would maybe switch to crowns is if their entire bite is collapsed from decades and decades of grinding. Then veneers alone are not the solution, because now the tooth or teeth have really been destroyed kind of 360 degrees. So that's why it's important to just make sure that when you're choosing someone that you look at their history and especially look at their gallery. That's their calling card, that's their portfolio, and that really shows you. Versus you will see some galleries where all the befores look different, but all the afters look the same. So whether you're a man, a woman, 6'5", 5'2", old, young, black, white, all the afters look the same. It's literally the same teeth in every mouth. It almost looks photoshopped because they're using the same lab. That lab is kind of a one-trick pony, and they make one thing, and everybody gets the same looking veneers. So you just have to be careful when you're doing the selection process. If you still think that you're a candidate for veneers, what I would suggest is definitely doing some research, going on more than one consultation. There's really no harm in getting multiple opinions. You could drop a comment, ask a question. I'll be glad to answer it for you. I do FaceTime consultations. Most dentists do. It's really important that you check the experience of the person who you are selecting. And, the more information you gather, then the better decision that you can make. So I hope this has been helpful, and I'll see you guys soon.